Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we are going to talk about Ultherapy. Ultherapy is the name of the treatment and Ulthera is the name of the device. However, they are often used interchangeably, Ultherapy, Ulthera, etc. Ultherapy is a deep ultrasound treatment. The device uses ultrasound to cause microtrauma to the undersurface of the skin, and then that microtrauma has to heal, and that causes collagen stimulation and often a small contracture of the skin as the micro wounds heal on the inside. Ultherapy has been FDA approved for a long time for skin tightening, over a decade. It is approved for use on the whole face, both the upper and the lower and around the mouth, the full neck, and the décolleté on the chest. It is sometimes used off-label in other areas, but those are the FDA-approved areas. Ultherapy is considered a no downtime procedure. However, it does hurt a little bit as it's being done. It works very well on some areas. The most popular areas that we treat in our office and that we get the best results are the jawline, the skin underneath the chin, and also under the eyes. It also works best on thin-skinned patients. We also do something that we call Ulthera Collagen Boost, where we use it on a lower level on the whole face for collagen stimulation, and when we do it that way, it does not hurt that much. Ulthera gives small improvements. It is a great non-invasive way to tighten skin with no downtime, but the results are small. It is good for people with a small amount of skin laxity. It is not a facelift, and it does not give surgical results. We have been performing Ultherapy for many years, and our patients are generally happy with it, but we counsel patients extensively in advance, and we set realistic expectations, and for the right patient, it is a revolutionary treatment. I often get patients afraid of it and asking questions about fat melting or filler melting, or maybe it's not working well enough, and I'd like to just address those issues. So number one, I would not be afraid of Ultherapy or Ulthera. The main downside of it is that it hurts. There are techniques to make it less uncomfortable, but it does actually hurt when you're having it done, and that is really the only thing to be worried about, in my opinion, if it's being done properly. And we've been using it in our office for many years. We will often do a little no-charge test area on someone so that they can see what it feels like before they sign up to do the full treatment. Number two, it is a very powerful device. And if we are doing both Ulthera and fillers, I would of course do Ulthera first, and then wait a month or two to put the fillers in. Or if you've had fillers before, I would wait at least 2 to 3 months, if not 6 months, after the fillers before doing the Ultherapy. However, in my office, we're typically not doing the fillers and the Ultherapy in the same location, so it really doesn't matter all that much. But if it is an issue and you're doing it in the same areas, you just have to separate it by time. Number three, I have never seen Ultherapy melt fat, but it is possible that this could happen because, as I stated before, it is a very powerful device, and the person performing the treatment has to be very careful at what level of the skin they are aiming the ultrasound beam. They can see it on the screen. It's an ultrasound, and if they do not aim it properly, it is possible that they could be hitting fat and decreasing fat in the face. However, in my office, I've never seen this happen. Number four, I'd like to explain that in our office, most of the patients who come in for an Ultherapy consultation, I say no to them. They don't need it, or they are not good candidates, and maybe they need something else. I'm just very honest with people, and I will only do Ultherapy if I think it's a really good idea for that particular patient. I will say that, unfortunately, there are a lot of facilities and places around the country and the world that don't necessarily abide by that honesty, and you have a technician who may honestly being paid on straight commission, and so if someone comes in asking for something, they may just sign them up and do it, even though the patient is not a great candidate. And of course, this doesn't always happen everywhere, but In my opinion, that is why sometimes there's a lot of negative online reviews for Ultherapy, because I think there's a lot of people doing it on inappropriate patients out there. That is just my opinion. In my office, I will only do it on people who I think are great candidates. And so if you're not sure, it's probably good to get more than one consultation and ask a lot of questions to determine if Ultherapy is the right treatment for you. In my office, if it isn't, I will be saying no. So those are the questions that people usually ask me. Now I'd like to talk about how to prepare for a treatment if you're having an Ultherapy treatment. Basically, I just tell people to avoid blood thinners and don't use any irritating skincare products. While it is considered a no downtime procedure, on rare occasions someone will get a bruise, so I think it's best to not do it the week of a big event. The appointments are typically in my office 1 to 2 hours. As I have said before, it does hurt a bit as it's being done. Patients can take Tylenol in advance if they prefer. There's really not much else to do. Numbing cream doesn't really work well for this particular procedure. And afterwards, it's usually no downtime. People just walk out. There's no issues whatsoever. But the area that was done often will feel sore. So when you touch the area, if you're putting on sunscreen or moisturizer, it hurts a little bit. It's not major. It doesn't hurt when you're just sitting there. But if you touch that affected skin, it will be a little bit sore. And as I said, bruising is incredibly rare, but on occasion, every few years, somebody gets a little bruise. In terms of follow-up, we see patients back in 6 months. Full results are usually 6 to 9 months later. Sometimes we do it more than once on the same area, but it takes 6 to 9 months for collagen to remodel, so that's why the results are delayed a bit. People often ask, how long does it last? I usually say results typically last 2 to 3 years or so. Depends on the area treated and how good the patient is about taking care of themselves. Do they use sunblock? Do they stay out of the sun? Do you eat healthy? But basically the body continues to age, so at some point we end up doing it again. So in summary, Ultherapy is a great non-invasive, FDA-approved way to tighten skin. It works all over the face. I like it best for jawline, under the chin, and under the eyes. I think it's also very good at stimulating collagen, so sometimes we will do it on a low level everywhere. We call that collagen boost. It is considered a no downtime procedure. However, not everyone is a good candidate. It does work best for people with thin skin and a small amount of loose skin. The main downside is that it does hurt as it's being done, but it does work really well, and we've had lots of success with Ultherapy over the years. I hope this was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.